Module Overview. This module provides foundational and practical knowledge of personal health, hygiene practices, and infection control protocols essential to safe and ethical nursing care. Hygiene and infection control are the cornerstones of patient safety and public health within any healthcare setting, especially in nursing, where frontline workers directly influence transmission prevention and health outcomes. The module is structured to introduce you to basic microbiology, standard hygiene protocols, and global best practices in infection prevention and control (IPC). It emphasizes core EU public health frameworks, the European Centre for Disease Prevention and Control guidelines, and World Health Organization (WHO) strategies. By understanding how infections spread, how to prevent cross-contamination, and how to apply proper hygiene protocols, you will be prepared to function in high-standard care environments and maintain the rigorous clinical sanitation protocols required in the EU. The module also addresses occupational health, personal grooming, ward cleanliness, universal precautions, and barrier nursing, while aligning you with real-world EU health standards like ISO 9001, ECDC IPC standards, and EQF Level 4/5 Health Knowledge Competency Requirements. 1. Introduction to Infection Control, Definition and Significance of Infection Control in Healthcare, History and Evolution of Hygiene and Antisepsis in Nursing Case Studies, Florence Nightingale's Sanitation Impact. 2. Microbiology Basics, Types of Microorganisms, Bacteria, Viruses, Fungi, Protozoa, Helminths, Pathogenic versus non-pathogenic organisms, Normal flora versus opportunistic infections, Routes of transmission, contact, droplet, airborne, vector, fomite, incubation periods and contagion stages. 3. The chain of infection. 6 components: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host methods to break the chain at each point, clinical relevance, MRSA, tuberculosis, COVID-19. 4. Hand hygiene and personal protective equipment, PPE. WHO's 5 moments for hand hygiene. Alcohol-based hand rub versus soap and water, gloving, gowning, masking protocols, proper donning and doffing techniques, disinfection versus sterilization. 5. Waste management and environmental sanitation, classification of medical waste, sharps, biohazard, general safe disposal procedures for contaminated materials, needle stick injury protocol and post-exposure prophylaxis, environmental hygiene, floors, bedding, toilets, and instruments, use of antiseptics, UV light, and air filtration. 6. Barrier, nursing and isolation techniques, isolation precautions, standard, airborne, contact, droplet, zoning of contaminated and sterile areas, negative pressure rooms and ventilated spaces, procedures for handling infectious patients, psychological considerations for isolated patients. 7. Personal hygiene and professional grooming, daily self-care standards for nurses, bathing, oral hygiene, clean uniform, hair, nails, and hand cleanliness expectations in EU healthcare, wearing minimal jewelry, trimmed nails, closed shoes, deodorants, uniform codes, and laundering impact of poor hygiene on patient trust and hospital-acquired infections. 8. Health screening, immunization, and occupational safety vaccination requirements for EU nurses, hepatitis B, TB, COVID-19, etc. Pre-employment health screenings, bloodborne pathogen training, exposure incident reporting and documentation, risk assessment and hazard identification,